Hello, I'm Dr. Frances Pitsillis. There's been a lot of talk about treatments around the world that may be useful for COVID-19 virus. It's the 7th of April, and at this point the review is just what I will describe in terms of potential treatments that may become useful and in some places are already being used. Now, you've already heard that a vaccine will take several months, but I want to give you some encouragement because of the research that's been done in different parts of the world. There are 2 antivirals that could potentially be used for mild through to moderate illness, and these are remdesivir, that's remdesivir, and also hydroxychloroquine. Now, for acute treatment, when you're very sick and you're on a ventilator, people have spoken about intravenous vitamin C along with B vitamins and steroids. So the only other treatment that people are researching right now is the convalescent serum, and that is when you take the blood of someone who's recovered from COVID-19 and you take out the serum. That's if you leave the test tube standing, it's the yellow part, just the plasma, and it contains antibodies against COVID-19. So that's what people are looking at overall. Now, you might say, well, how solid are these recommendations? Well, most of the recommendations are based on knowledge that we already have about these drugs and treatments, and for the most part none of them are yet but soon to be based on gold standard trials. Now, a gold standard trial in medical terms is called a randomized control trial, and this is where the researchers take a huge number of people and give half of them the special treatment. Now, usually it's double-blinded, which means neither the patient or the researcher knows who got what. So that's a gold standard trial. Now, because COVID-19 has been creating a lot of disruption and doctors have had their hands full treating patients, it's been difficult for people to do these randomized controlled trials. Some of them have started seeing trends. And others have done small trials, which are observational trials, and that means they've observed what's happened to a number of people who were given the treatment. They didn't randomise them or blind them. So what about remdesivir? Well, that drug was first developed in 2017 for the Ebola virus. And the way it works is that it stops the virus from replicating itself, duplicating itself. Test tube studies have shown, only in test tubes, that it can inhibit other coronaviruses such as SARS and also Middle Eastern respiratory syndrome. But what we can look forward to are 2 randomized controlled trials that are going to be ending at the end of April and early May, and one of them's 308 people and the other one's 453 people, so that's coming up. Now, in the meantime, there's also been people looking at chloroquine, which is an anti-malarial drug that we've had for 70 years. It's well known what it can do and what the side effects are. But hydroxychloroquine, which is a relative of this, is used in autoimmune diseases like lupus and rheumatoid arthritis. And this medicine has broad antiviral activity and works to stop the virus from binding onto the receptor site to be able to get into the cells. It interferes with virus duplication, and it balances the immune system. Now, some people have said that this is a good thing because what causes the severe lung damage and death is the immune system going crazy. They call it a cytokine storm, and then the person gets very septic, inflamed, and their lungs are terrible. So this could be part of its action, but no one really knows that for sure. There was a paper from China that recommended it on the basis of observing 100 patients who recovered with superior results to a control group, and that it shortened the course of the illness. There are some trials going on across China, and in fact I noticed that on the media very recently in the USA, doctors are starting to use it, and there are trials going on there. Now, we've also heard at one stage a mention of a combination of hydroxychloroquine and azithromycin together. So azithromycin is an antibacterial that you usually give to people for pneumonia. So a paper that I found was a French group that studied this combination and found that people on chloroquine did better, but with both they did even better. The only problem with that is that the study had only 20 people in it, and only 6 of the 20 got both. So it's a very small study, but on the media I've heard of another study that has been reported. The only problem with this treatment is that there could be an increase in cardiac risk, so the ECG would have to be monitored. Once again, small studies, not enough numbers, not randomized, not controlled. So this is the problem that we have around the world with doctors who are at the very conservative end saying, well, we haven't got enough data. But the doctors that are right on the coalface are going to have to make some decisions for people who are very, very sick. And I think that if you've got nothing to lose, I think there's enough information that some of these decisions will get made. Now, once again, we've had some research from China about the use of intravenous vitamin C in sepsis. Now, sepsis is what happens to anybody who's very sick in intensive care, whose lungs start to fail, and then kidneys and heart start to fail as well. And this is what happens in the coronavirus as well. There's been established research that intravenous vitamin C and with B vitamins halves death rate in sepsis. So this is very encouraging, and because of that, a group in Shanghai had a look at this and gave the treatment to 50 out of 358 people due to their extenuating circumstances, and they found that all these patients improved and didn't die and didn't have any side effects from it. There are more ongoing trials that are going to start to help us with this. Now, how does vitamin C work? It's just a vitamin, but it's anti-inflammatory. It counteracts the cytokine storm. It's an antioxidant. It neutralizes damaging molecules called free radicals and reactive oxygen species. And it actually supports the heart and the blood pressure by stopping the blood pressure from dropping and by stopping the heart failing. It increases noradrenaline, dopamine and vasopressin production, which would normally start failing. It also stops the cell barriers intact. It stops leakage into tissues, which also makes the blood pressure drop. So when I last checked, what did the World Health Organization say about these treatments? Well, in their latest document, guidance document to doctors around the world on the 13th of March, they said there is no randomized controlled trials, and therefore this is the treatment, support, which is no drug treatment. So really in the end, I think what you need to know is that the governments around the world and the health departments around the world know all this, because this research is readily available. It's out there and increasing. You can be reassured that the vitamin C, the convalescent serum, by the way, there's more trials with the convalescent serum as well. we're going to get more and more knowledge, and doctors are already armed with the knowledge to be able to make individual decisions for each patient. And if there's nothing to be lost, they are very likely to take action. So I hope you find this information interesting. This is not a replacement for any individual consultation, and if you have any concerns at all about your health, you should seek advice from your doctor or your local health support phone number. Until next time, this is Dr. Frances Pitsillis.